Hello and welcome to Empathy HIT. Your host, Dr. Sandy Whitehouse, is the CEO and CMO of Ticket Health, an award-winning global provider of digital solutions for capturing data directly from and in communicating with vulnerable people within diverse populations. On this podcast, Dr. Whitehouse chats with providers, partners, and industry leaders on topics ranging from digital empathy to social determinants of health, to rethinking how we collect information critical to improving health outcomes.
Welcome to Empathy HIT, where today I am honoured to speak with a true innovator and game changer. Dr. Jennifer Salerno is a paediatric nurse practitioner and translational researcher with over 25 years' experience working in the field of adolescent risk and prevention. She has served as a board member and advisor on many US state and national initiatives to improve adolescent health. Jennifer became concerned about the variability in care she was seeing across the nation and found that at a grassroots level it was often associated with the level of an individual professional's experience, their subconscious bias, or discomfort with particular risk topics. These experiences prompted her to found the company Possibilities for Change in order to provide professionals and parents with the training, tools and systems necessary to confidently identify and reduce youth risk. Welcome, Jennifer.
Thank you, Sandy, for inviting me. I really appreciate the opportunity to talk with you and share my passion for youth prevention.
Yeah, it's a very important work. So let me start. As a nurse practitioner, you appreciate the critical importance of identifying people in need and providing them with support. That support can make the difference between someone who struggles and fails and one who can overcome their challenges and embrace their future. Tell us more about what motivated you to start Possibilities for Change.
Sure. Yep. Basically, throughout my career, I've been dedicated to those unique issues that affect youth. And when I talk about youth, I'm really talking about early adolescence, that 9-year-old time frame, all the way through late adolescence, which can go up to 24 years old. So thinking about adolescence and the huge changes that happen during that time, if you don't already know, 3 out of 14 deaths are related to risk factors like texting and driving, suicide, drownings. It's not disease like adults, so it makes it a lot more difficult to manage that as a clinician. Most of us avoid asking teens those really hard questions about risk, what they're engaging in or what they're thinking about, because then we're afraid of hearing the answers and not knowing what to do or feeling responsible for that. So while I was working as a nurse practitioner at the University of Michigan, I developed an easy-to-use risk screening tool called the Rapid Adolescent Prevention Screening, or RAPS for short. That was in 2006. And since then, RAPS has been validated as a time-efficient and effective comprehensive risk screening tool and also as an adolescent depression screening tool. And U of M helped me start my company, Possibilities for Change, like you mentioned earlier, to really be able to move RAPS outside of that academic institution or the academic walls to real world use. And it's not always easy to connect with and communicate with teens on any topic, let alone those sensitive issues like sexual health, substance use, or mental health. And RAPS getting outside of the university really helped me kind of bring it to other professionals, other clinicians, to really bridge that gap between provider, professional, and youth, and is now a gold standard for youth risk screening and being used worldwide.
Yeah, that's an amazing achievement and really addressing a very difficult problem of that facing young people and dealing with those really sensitive and often stigmatizing topics. Mm-hmm. We're hearing more and more about the importance of empathy and the impact that has on delivering care. And more recently, there is a new concept called digital empathy that is bringing the empathetic approach to technology. So I'm interested in the RAPS tool and how that works with digital empathy, and how does digital empathy engender greater trust with vulnerable populations? And can you share some specific examples?
Yep, that's a really great question. And I think when we're talking about risk screening, teens are the perfect example for that. So if we look at research, it shows that youth respond more truthfully with technology. So that's really the first step, and that they prefer to use technology for risk screening. They've kind of grown up with it. That's how they communicate. It helps them feel a lot more comfortable. So there's a lot of factors that go into this. Technology doesn't vary in its tone of voice. So if we're asking questions, sometimes it sounds different to youth and they can respond differently. There's no body language that conveys judgment. Every youth is screened the same way every time. So it ensures standardization of care. So that's the success of technology. So if you're looking at the next step, the platform really makes a difference. The current RAPS tools have been developed in partnership with Ticket Health using embedded digital empathy, like you were sharing earlier when you were starting out your question. So if you're not familiar, because digital empathy was a new term for me as well, digital empathy is a concept of using images, using colors and design to really create a caring and comfortable, safe space for youth. So it enhances their engagement in reading through the questions, reading through some of the other information, and their honesty. So it's a really important piece when you're thinking about a technology-based tool. What does that actually mean, and how do you convey empathy? Because we know that that helps establish relationships, and it also helps youth feel more comfortable and more honest when they're completing any type of screening tool. So the content of RAPS includes questions and health messages that show up for youth when they complete the survey for those questions that they answered as a risk. And then these messages prime youth for discussions about their risks with the professionals that might be meeting with them, and helps equip those professionals with talking points for helping youth make safer decisions, ultimately reducing their risk and getting the help that they need. So the combination of the RAPS tools as validated risk questions that are continuously reviewed to ensure that we're asking the questions that cause the most morbidity and mortality in youth, and then embedding them in a technology that has digital empathy, really makes a powerful tool for risk screening and coaching. So you're looking at an effective tool and a very effective technology. It's the perfect combination.
Thank you for that. It sounds like the technology can really enhance the care and support care providers in providing more of that messaging. So the technology actually is working to provide a conversation for the young person, and has that interactive component, which is so important. So it's really great to hear, and I know that you've been very successful with school-based health centres, colleges and healthcare providers, and other professionals are using the RAPS tool and evidence-based risk identification to improve adolescent health. Where do you see these assessment tools as making the biggest difference?
I think another benefit of the technology, that technology-based approach, is the scalability, and that's where it makes the biggest difference. So professionals use the RAPS tools embedded in this technology to identify risks at that individual level. So just like I explained, related to asking the questions and providing some of that support to the youth, but also to the healthcare provider or professional that would be meeting and talking with them, that can make a significant impact in the effectiveness and quality of care for youth. So on that individual level, it makes a huge difference. But looking at youth across programs, across schools, every year, thousands of youth receive risk reduction counseling or risk reduction coaching for sexual health, bullying, and depression using the RAP system. We've even seen the RAP system help save lives by identifying youth at risk for suicide that were flying under the radar, whether it was a patient in a clinic or a school. When you take the technology, very easy to use, with youth being able to respond using technology and then provide that information for a school building, for a school district that is actionable. So those youth that need support get it right away. And entire populations of students, then you have the data that can be used to identify needs, to direct programming, to direct funding, maybe partnerships within a community. And I think that is what makes the tools so powerful and have the biggest difference.
Yes, that's very exciting to hear. That greater response rates and that scalability can lead to better quality data and ultimately better decisions and programming for really large populations. But you also talked about that grassroots level, and I was wondering if you could share some real life successes where you've been able to identify youths and adults at risk.
Sure. So as the pandemic has so dramatically highlighted, social determinants of health have had a really significant impact on just access and effectiveness of care over the last year, year and a half now. So we had worked with the American Public Health Association some years ago and created a public health version of the RAPS risk screening that helps identify social determinants of health that affect youth and their success, their academic success towards graduation rates. So, for example, some of the questions that are in the public health version or the social determinants of health version of RAPS have questions about access to food, electricity, running water, some questions related to being able to read, or are they struggling academically? So schools have partnered. So working with their local health department, schools have partnered to provide an entire youth screening within a school district using the RAP system. So one of the examples I want to share, schools in Cincinnati, in addition to connecting kind of individual youth that were at risk, identified with referrals and maybe some counseling, they were able to create community partnerships and implement more systematic changes to address those identified population needs. So they created a food pantry with some community partners, sent kids home with backpacks of food over the weekend because there was food insufficiency at home. They were eating while they were at school, but those weekends can be really long. They also created a laundry and shower facility within the school for students to use that were struggling with having consistent running water where they lived. But I think the biggest impact was the shift in awareness and the creation of a culture of support. So it wasn't just academic support, it was support for everything that might be happening in their lives that ultimately is impacting their academic success.
That's definitely a win, and you must be proud about the ability to make changes by using technology and by supporting schools and populations and communities in this way. What are some of the other things you've seen along your professional journey that were just so inspiring? And I'm sure you've had challenges. What were some of the pit stops that really kept you fired up?
I think the biggest challenges have been just around supporting those professionals in doing the hard work of screening. There's pieces of workflow that need to be implemented, especially if you're screening in some of those organizations that it might not be as familiar. So if you're in healthcare, that feels familiar. We're screening youth around risks as part of the care we're providing. But in schools, it can be a little more challenging. And trying to help and figure out how to make that so much easier starts with using the right technology and having experience of working with multiple schools across the US in different states and really creating that learning community to help with kind of lessons learned. So how did this work in the screening? How did we access the data out of the technology and utilize that for some of those partnerships that I mentioned earlier? And then the other piece of my work is really around providing that increase in skills and confidence with some online and live trainings for professionals and parents in how we talk with teens. So I realized really quickly after launching REPS that all of us, the professionals that work with youth and parents, really needed more effective strategies in helping engage youth around those tough topics. So once you find out what's happening, how do you talk about it? That was the question I was hearing a lot. So looking at kind of literature, what types of communication strategies are most effective, what it shows is that professionals that feel skilled and confident in having those risk discussions are more likely, one, to have them, and two, for them to be effective. And then looking at parents, they are a key protective factor in youth risk. And equipping parents with those same skills and confidence, that can really be a game changer for decreasing risky behaviors in youth. So if we're looking at it more on a comprehensive level, how can we help equip professionals using the technology and also, that next piece of what do you do with that information? So that's really what I'm most excited or keeps me kind of going.
Yes. So the technology is the foundational framework, and then looking at the possible pathways that technology can lead to.
Mm-hmm.
Very exciting. Yeah. Thank you very much for sharing your expertise and passion and compassion around and the work that you're doing. It's been fascinating, and thank you very much for joining us today.
Yes, it was a great discussion. Thank you for inviting me. I really appreciate it.
Thank you for joining us today. You can follow the conversation on Empathy HIT on Healthcare Now Radio or at tickethealth.com or at #DigitalEmpathy. And be sure to follow Dr. Whitehouse on Twitter at Sandy Whitehouse.